Person-centered therapy. Person-centered therapy is the non-authoritative approach allowing clients to take the lead in discussions so that eventually they will discover the solutions to their problems. During person-centered therapy, the therapist acts as a facilitator, focusing on the client's feelings in order to make the client comfortable while in therapy. The therapist supports and encourages the client without interfering in the client's self-discovery process. Founder of person-centered therapy, Carl Rogers. During the 1950s, Carl Rogers proposed that the therapy could be simpler, friendlier, more positive than behavioral or psychodynamic approaches. Rogers believed that therapists should be warm, genuine, and understanding. Rogers once said, "An individual has within himself or herself the ability for self-understanding, for changing self-concept, attitudes, and self-behavior only if the appropriate therapeutic climate is provided." Rogers developed his theory based on experience gained during counseling emotionally troubled clients. Rogers was a firm believer that every human has a remarkable capacity for self-healing and personal growth leading to self-actualization. Self-concept. It is a key component in person-centered therapy. Rogers believed self-concept had 3 different components. Number 1, self-image. The view the client has of himself or herself does not essentially reflect the reality, as a person's self-image is affected by factors such as parental influences, friends, media, etc. Number 2, self-esteem. How much value the client has on himself or herself. Self-esteem may be either a negative or positive view of ourselves. Number 3, ideal self. What the client wished he or she was like. If a client's ideal self differs from real life, incongruence occurs. When a client's ideal self and actual self are consistent or similar, a state of congruence occurs. According to Rogers, a person must achieve congruence in order to achieve self-actualization. Who can benefit from person-centered therapy? Anyone interested in gaining self-confidence, stronger identity, and trust in his or her own decisions. Person-centered therapy can help people suffering from depression, anxiety, stress, and mental conditions. What to expect during person-centered therapy? The client does most of the talking. The therapist will not critique your statements, but may repeat your words in order to fully comprehend your thoughts and feelings. Person-centered therapy facilitates clients' self-discovery and self-acceptance. How does person-centered therapy work? Created by American psychologist Carl Rogers, who believed people had the power to find solutions to their own conflicts. The success of person-centered therapy relies on 3 core conditions. Number 1, congruence. Therapists must empathize with the client and must be understanding in order to encourage clients to trust their own decisions. According to Rogers, congruence is the most important factor in counseling, as clients are able to experience therapists as they really are. Number 2, unconditional positive regard. Therapists must understand and accept their clients' feelings. Therapists need to show deep and genuine care for clients and maintain a positive attitude towards the client. Number 3, empathetic. Therapists are not authoritarian but instead show an honest and a genuine personality. Therapists should understand their clients' feelings. Clients that are highly motivated during person-centered therapy are more likely to succeed.